Good morning, everybody. I am Dr. Sandeep Kumar. I'm working as a consultant neurologist in Yasaka Hospital, and sorry from my side for those glitches. What is the topic proper? What is understanding and management of dementia? I hope after end of this session, we can explain you what is dementia, what are the early signs and warning signs of dementia, risk factors of dementia, and what is the importance of early diagnosis and different varieties of management or modes of management such as pharmacological and non-pharmacological managements are available. Before going to the dementia as proper, let us meet. We should know who are our friends or like what is cognition. So cognition is the word which we use to describe the things or modalities by which we do daily activities. It could be memory. It includes memory, language, attention, visuospatial. Visuospatial means it helps us to orient ourselves in an environment, like which way, where I kept my purse, whether whether I have to take a left turn or whether I have to take a right turn. So, as executive functions, which include planning, organizing things, making decisions, or solving the problem step by step, as well as social cognition. So, what is social cognition here is like empathy, sympathy. When some person is telling you his grievances, we don't laugh at them. We respond as per the people's emotions. So this all six include cognitive domains. Deficit of any one of this can cause impairment or or this is known as dementia. So dementia is the devil in the room. So deficit in any of those things can cause dementia. So what is dementia? Dementia is an umbrella term. So dementia is an umbrella term which include group of symptoms or syndromes affecting memory, thinking, social ability to do day-to-day activity. So as I previously explained, deficit in any one of those cognitive domains can cause dementia. And one more thing I want to emphasize here: dementia is not normal aging. Doesn't It is not a part of normal aging, which is a myth. Coming to the numbers, why should we learn about dementia? Why should we think about dementia? Around 55 million people worldwide living with dementia and nearly 10 million people diagnosed every year. And it affects every background person. It affects all backgrounds and ethnicities. Most commonly seen in people above 65 years, but it is not exclusive. A lot of people are there, or in clinical practice you have seen people come with cognitive impairment the age of 50, 40 years also. Among all these dementia, 75% cases are there in low income countries like India, Southeast Asian countries, and among them, 75% cases they go undiagnosed. And globally, taking care of dementia patient is costing us around 1.3 million trillion dollar. I think it is a very huge cost. So, as I mentioned, dementia is an umbrella term. So, what are the different types of dementias? Like as we have different causes of fever, we have different causes of dementias. One of the most common which we all heard about is Alzheimer's. Others are vascular dementias, frontotemporal dementia, dementia with Lewy body. Among them, most common is Alzheimer's. Other group known as mixed dementia is the most commonly seen in older people above 70 years. That is mixture of vascular dementia, mostly Alzheimer's. So before going to the dementia proper, I just want to know, I just want to emphasize here difference between normal aging and what is worrying forgetfulness. It is normal forgetfulness and abnormal forgetfulness. See, all memory losses are not dementia. I have seen lot of people coming to OPD complaining, I am forgetting, I may develop Alzheimer's. I'm not able to do this thing. I'm forgetting name of the people. I may develop Alzheimer's. Usually, those people are not forgetting, or we can say they are not developing dementia. It's a normal forgetfulness. So, what is the difference between normal forgetfulness and when to or the abnormal one? Like occasionally, we all forget names. But when we try to think about it or we try to remember it, we can remember the name. But forgetting close family members' name like your sister, your daughter, your cousins, your brothers is abnormal, and never able to recall them is also abnormal. Sometimes we keep something somewhere, and but we are able to retrace the object is normal forgetfulness. But putting the object in some abnormal places, like keeping, for example, water bottle in your wardrobe, keys in your refrigerator, and forgetting about it, and you won't realize you are keeping something that is abnormal. We may forget tracks of the day, like what happened on that day or what happened this day, but after rethinking about it, or after putting emphasis, we can able to recollect. It's normal, but we lose track of whole days and night, and we do not remember. That is abnormal. Forgetting, sometimes we may have word finding difficult. It is unable to find the right word mid sentence. Is okay, but forgetting complete word or using of wrong names or asking or repeating same thing is abnormal. So one should be very much clear about what is normal aging and what is very forgetfulness. So, what are the early signs? Now, coming to the, we discussed about the early signs, abnormally forgetfulness. What are the 10 early signs we should remember or we should all be very critical, aware of? It is memory loss, which disrupts our day-to-day activity. Like I'm paying same electrical bill two times, forgetting appointments, forgetting events we went. We face trouble completing familiar tasks, like a housewife who can close their eye, can cook rice and dal, or a banker who can calculate in minutes, but they face difficulty in doing those activities. Special problem, like I'm getting confused in their own house, like the house they were staying for 10 to 15 years. Now they are unable to recognize which is their room, which is their children's room, where is the washroom, where is the kitchen. Similar way, misplacing things frequently, withdrawal from social activities, and then change in the part. They start behaving very abnormally, doesn't want to meet with people. The person who used to enjoy watching movies suddenly is very withdrawal and doesn't want to watch movie. Difficulty in problem solving, getting confused in time and place, difficulty in using languages, doing very simple judgment mistakes, like putting the gas stove on the switching, forgetting to switch off the gas stove, or removing the rice before it is cooked properly, change in the mood and personalities. These are the 10 early signs which one should always be wary of. And if you find any of those things, you should always reach to a GP. So, how dementia is diagnosed? Dementia is diagnosed after seeing those early signs. One should reach your general physician, give a complete history, and he or she will do the cognitive assessment. We have scales which can be, this is a question answer based, MMSE, MOCA, AS, which are all adapted to our Indian culture, Indian language, and thinking skills. After that, we can run some blood tests to rule out any other causes of dementia, such as vitamin B12 deficiency, thyroid issues. Some chronic infections can also cause memory loss. Then scans followed by specialist review. So, what are the different stages? I saw somebody has asked whether all this start together, or what are the stages of dementia. Dementia can be divided into, or we can say, whether we can use the term cognitive impairment instead of dementia, because dementia has a very taboo associated with the name. So we will be using the term cognitive neurocognitive impairment or cognitive impairment, and we can group into three parts, or three stages. One is known as SCI, subjective cognitive impairment, where patient may have memory loss, may be facing difficulty in doing the activities, but on routine cognitive assessment, they are normal. MRI may or may not be showing atrophy. MCI is just like, we can give the closest example we can say is diabetic. One in risk for diabetic patient is having pre-diabetic and diabetic. So is SCI is patient is having risk of diabetes. MCI is like pre-diabetic, where patient have memory loss, but he is able to do all his daily activity. He can go out, he can take care of himself, he can dress himself, he can take bath, he can eat himself. Next stage is dementia, where the patient is completely dependent on their caregivers for the activity. So most of the people coming to our clinic, or 90, I can say around 80 to 85% people of dementia are in this SCI and MCI stage, and very rarely people go to dementia, and people tend to stay in MCI and SCI for years long. So, what are the risk and protective factors of dementia? We so till now we discussed what are dementias, what are the causes of dementias, what are the early warning signs. Now coming to the risk factors, or we can say the factors which influences the focus of dementia and how to strategize and prevent it. So factors linked to dementia are always the age. Age is always a risk factor which is non-modifiable. We cannot change. We cannot be young. And you will always grow old. Other things which are like, you can see below this line, those are all reversible, those we can prevent, like early quality of education, hearing loss, high cholesterol diet, depressions, brain injuries, lack of physical activities, visual impairment. So all the sensory impairment, if a person is having cataract, a person is having hearing loss, if he doesn't use those devices, doesn't correct those things, may end up developing cognitive impairment. They may not cause the cognitive impairment, but they will contribute to the progression of the disease. Similarly, alcohol intake, sedentary lifestyle, high blood pressure, smoking, diabetes, socially isolation. You would have seen a lot of people with dementias. There is a jump in number of patients complaining with memory loss after COVID lockdown, and which puts an emphasis of social inactivity or social isolation. Similarly, air pollution. As I previously mentioned, in 1 in 3 cases of dementia can be prevented by addressing those risk factors. Increasing education. If we learn new language every day, if you try to read new books, if you try to keep ourselves active, nothing. You can go for a morning walk and evening walk. Be with people, contact, go to kitty parties. You can go to social gatherings, controlling your blood pressure, obesity, smoking, getting treatment for diabetes, depression, hearing loss, all can prevent your dementias. So dementia as such is not a taboo, or it is not preventable. It's more like a disease which we tend to get it, or we tend to purchase it. So now coming to the management part, I think I am very much clear about what is dementia, what are the risk factors of dementia. Now coming to the management. So what are the management available for dementia? We can divide into pharmacological management and non-pharmacological management. Pharmacological management are the medication which help us to manage the dementia symptoms. Non-pharmacological, which my next speaker will say in detail, is plays a very important role in diagnosis or in management of dementia. So a lot of people tend to stick to the pharmacological management. They look for the treatment. They go to the doctor. They don't doctors. They are looking for the cure. As I'm a clinician, I will be focusing on the pharmacological part, but we should always non-pharmacological part along with pharmacological part. So the pharma management overview. What is the overview? Like we have first of all, we should understand there is no drug cure for dementia. The medications are aimed to slow the cognitive decline, slow the management symptom, improve the quality of life. What are the medications available? Cholinergic inhibitors, NMDA receptor antagonists. I want to put emphasis here. These medications are predominant for Alzheimer's type of dementia. It may not work in every. So 90% of people have psychiatric disorders or psychological symptoms. We won't say it is a psychiatric symptom. I will say it is a neuropsychological symptoms, which psychosis, sleep disturbances, because patient unmet needs. Like the patient will be telling, like, I want to go to washroom, but he is not able to convey it, or she is not able to find the way to the washroom, and they may get agitated, they may get irritated. So ideally, I will advise you to first cater to that unmet need. Like first understand why he is getting agitated, why or he or she is getting depressed, why he or she is having anxiety. If at all you are not able to control by non-medical way, or patient is so much aggressive or so much violent where she can harm you or harm herself, then only we should go for these medications. And this medication should be taken for very least duration and least dose, because they also come with their side effects, such as antipsychotics like risperidone, which I have mentioned here, can increase your Parkinsonism. They may cause increase in drowsiness leading to fall. I won't say we should not use this medication. I want to emphasize here is we should use this medication, and this medication should be used in a very least dose for the least durations, but should be used. So, what are the newer drugs which are coming for the management of dementia? There is a buzz now for this anti-amyloid therapy or anti medications for the Alzheimer's, which are available now in India. They are lecanemab and donanemab, and they target the biologicals, not the pathology behind the Alzheimer's. That is the amyloid plaques. They don't treat the symptom; they treat the pathology, and they work in very early stages, putting emphasis on early diagnosis of dementia. But they don't act if the patient is coming in stage 3, stage 4, or stage 5 of cognitive impairment. They work in stage 1, that is an MCI or SCI or an early stage 1 disorders. So these drugs are lecanemab, donanemab. They are monthly or twice monthly infusions. They should be taken for 18 months. They have their own risk factors. They have their own contradictions. So one of the key points for the pharmacological treatment here is medications can significantly improve quality of day-to-day activity and should be taken in a judicious way. You should start slow, go slow, and try to give to the minimum dose for minimum durations. And you should always visit your doctor regularly. If you look fourth point, there is no current medication to reverse or cure dementia. I think I should go back and say it is not completely true, because there are medications which I have just previously I have shown you, lecanemab and donanemab, can to some extent stop the disease progression. Polypharmacy is always a risk. Giving 3 or 4 antidepressant, antipsychotic medications can make the person drowsy and increases the risk of fall. So all those things we should be very much cautious. But pharmacological therapy is also very important thing. So coming to dementia in India, why it is, how dementia is in India, and what is the present scenario, Indian scenario in dementia. In India, there is a aging, the people with 60 years old population is gradually is increasing, because till 1950s and 60s or till 1990s, the non-communicable diseases were most preeminent. The communicable diseases were causing a lot of deaths. Now, when we control those communicable diseases like malaria, dengue, diarrhea, cholera, and also we have improved our cardiological treatment, coronary angiogram, CAD, and all those things. We have increased the age span of our people. So older people, there is a rapid increase in aging population of our country, and which puts back dementia, which brings dementia into focus, because the which previously dementia is not in the focus of anybody, even the insurance company or in the government of India focus. So what is the current scenario? There are around 8.8 million people living in dementia. We can say one in among 27 people above 60 years is developing some kind of memory loss, some issues which is grossly underdiagnosed. And we can see only 10% of people in India are either diagnosed or able to reach facilities where these dementias are treated, or any they are reaching for the medical care. So what are the unique challenges and opportunities in the Indian context? So in India, still now dementia is a taboo. I've seen a lot of people who they don't tend to discuss what are the abnormalities or what are the complaint of the patient. They will discuss with a physician or one doctor, second doctor. They may not able to open it up, or only one person will open up, one person doesn't open up. And still there is a belief that dementia is a disease disorder of older people. I've seen a lot of people who come from dementia. It is seen in 60 years or is a disease of older people. Why should we think about it? It is true among physicians also, general physicians. I'm not talking about all the general physicians, I'm talking about some general physicians. And there is an insurance gap. A lot of insurance companies, they don't cater the dementia part. One unique thing is that India is a very diverse country where different people, different languages, different cultural beliefs are there. So putting everything in a one criteria or one standard of diagnosis is not possible. We should develop new skills and new way to diagnose dementia per their own cultural and ethnic and language basis. I cannot diagnose a patient with dementia or a patient who have a language issue who doesn't know what is a pasta, right? He would have eaten pasta at all, and he doesn't know pasta. Same way, I cannot tell a patient has cognitive impairment, a North Indian people who doesn't know Pongal, or South Indian people who doesn't know Litti Choka. So they are two different things. I cannot say like if I don't know this one, he has cognitive impairment. Litti Choka is very common in Northern India. So is Pongal in Southern India. These are the drawbacks. So these are the unique challenges. So what are the opportunities which I feel is still helping to dementia patient, dementia care is the joint family structure or the strong family support culture. Like, okay, a older people is there, we tend to take care of her, we tend to speak with her, grandchildren tend to play with her. And traditional practices or the cultural thing, we still are religious. It may sound controversial here, but I want to put emphasis. I'm not putting only in that one religion, I'm thinking about all the religions. So all these weekly congregations or bhajans or Sunday masses, what they do, these all are the part that Saadiya will explain you about the cognition stimulation therapy or the social gathering, where those activities they tend to activate your brain networks. Then we go out, we meet with people, we meet our near and dear, we discuss about things, we play the music, the rhythms, all those things help in decrease in the cognitive impairment. So instead of looking at this in the religious view, we should look at it as a way how we can cater those cognition stimulation therapy among people, normal people. And there is a growing network of memory clinics in our country, like ARDS. I have started before. We in Yasoda Hospital have a memory clinic with a neuropsychologist, Saadiya, only doing the activities. Same way we have in Nimhans, Bangalore, where we are reaching to the people and we are taking care of the patients. Now, a lot of technology reach is also there. People are using WhatsApp, people are using mail now, platform like WishwaTalks, and those people, they coming together and they are helping to raise the awareness about dementia among the people. So I just before ending my talk, or before handing over to Saadiya, I just want to bust some myths and facts about dementia. So what is the most common myth we all people are just asking you? You would have thought of dementia is just a normal aging. Everyone gets forgetful. Over 60 years. In Hindi we say satya gaya. Maybe the slang is very bad to some people, and just like saying dementia or forgetfulness, a person is getting old, forgetful. No, dementia is a disease which is more common in older people. Not all older people are forgetfulness. Nothing can be done. Dementia, nothing is a degenerative disorder. Nothing can be done. No, that is not. Early diagnosis, or whenever you're diagnosing the patient, we can healthcare facilities where they can give you medication, therapy, support, planning, future planning regarding how to improve the quality of life. Number third myth is only old people get dementias. No, people with 40 years also present with cognitive impairment. There are some dementias which come in as early as 35, 40. Frontotemporal dementia is very common in younger age group. Familial dementias, Alzheimer's can also come in mid 50s and 60s. Fourth most common is people with dementia cannot live a meaningful life. No, they with right support, right activities, with right therapies, they can stay independent, especially in the early stages. So our target is to keep those patients in a very early stage, not should not let them progress. And how to keep them in early stages, early coming to the doctor whenever you are seeing those early tense warning signs, taking the medications regularly, getting doing physical activities, controlling your blood pressure, sugar, diabetic medications, having a proper sleep, and other things which will explain that is a non-pharmacological part. Thank you very much. I'm handing over to Sadia for further.